Hello everyone, this is Syed Sagheer Ahmed. Welcome you to our YouTube channel. In this video, drugs for congestive heart failure part 1. I am going to cover definition of congestive heart failure, causes of CHF, drugs for CHF and mechanism of action of cardiac glycosides. So let's get started. Drugs used in the treatment of congestive heart failure. Before looking into the treatment of congestive heart failure, let us understand what is CHF and what are the causes of CHF. If we point out the problems in CHF, then we shall able to analyze how drugs resolve these problems and treat congestive heart failure. So what is CHF? It is an inability of the heart to pump sufficient quantity of blood to meet body's oxygen demand. Each and every cell of our body need oxygen for survival. To meet their oxygen demands, heart will pump oxygenated blood. But in CHF, heart is unable to pump sufficient quantity of blood. In simple words, we can say in congestive heart failure, there is a loss of pumping efficiency of heart. Well, what is the role of heart? Heart will contract and pushes blood to their respective arteries, that is aorta and pulmonary artery. Through aorta, oxygenated blood is transported to different parts of the body, and through pulmonary arteries, deoxygenated blood is transported towards the lungs for purification. During relaxation of the heart, it receives oxygenated blood from lungs through pulmonary veins, and it receives deoxygenated blood from superior and inferior vena cava. Calcium ions play a very important role in the contraction of heart. In congestive heart failure, heart muscles are not contracting properly. Due to this, heart cannot pump sufficient quantity of blood. This will happen due to various reasons such as myocardial infarction or heart attack. It happens when blood flows to the heart muscle is blocked or heart does not get enough oxygen. Usually, coronary arteries supplies oxygenated blood to heart muscles. In myocardial infarction, coronary arteries are obstructed or may be blocked due to atherosclerosis, that is a deposition of fat in the coronary artery, or maybe due to the formation of blood clot. Obstruction of coronary arteries reduces the flow of oxygenated blood to heart muscles. Then hypertension is also one of the cause because it increases afterload. The concept of afterload will be discussed very clearly in the upcoming slide. Any problem in heart valves may also be the cause of congestive heart failure. Overall, in congestive heart failure, due to less effective cardiac pump, blood is not pumped properly, so it remains in the ventricle at the end of each ventricular contraction. I mean, even after ventricular contraction, complete blood is not pumped, the blood still remains in the ventricles. Hence, preload increases. Preload is the load of blood on the ventricles at the end of ventricular relaxation period. Due to this, heart is overstretched. The concept of preload will be explained more clearly in the upcoming slide. Finally, force of heart contraction is reduced. Different categories of drugs used in the treatment of congestive heart failure. In that first category is inotropic drugs. In that cardiac glycosides, example digoxin, digitoxin. Sympathomimetics, example dobutamine. Phosphodiesterase 3 inhibitors, example amrinone. Second category, diuretics, high ceiling diuretics like furosemide, thiazide like diuretics, example hydrochlorothiazide. Third category, renin-angiotensin system inhibitors, AC inhibitors, example captopril, angiotensin antagonist, example losartan. Fourth category of a drug, vasodilators. In that venodilator, example glyceryl trinitrate, arteriolar dilator, example hydralazine, arteriolar and venodilator, sodium nitroprusside. Fourth category is over. Then fifth category, beta adrenergic blockers, metoprolol, bisoprolol, etc. Aldosterone antagonist, example spironolactone. I have used these terms preload and afterload of heart in my previous slides. So what does it mean? Preload is the load of blood falling on the ventricles during end diastolic phase, or the volume of blood in the ventricles during end diastolic phase. At the end of ventricular relaxation or just before the beginning of ventricular contraction, the load of blood putting on the ventricle is preload. Initially, force of contraction of heart is increased due to increased preload. Later, further increase in preload make the ventricles overstretched and it decreases force of contraction. Now, what is afterload? Pressure of the ventricles to push blood into arteries during ventricular contraction. During ventricular contraction, ventricles are putting pressure to push the blood into arteries. This is called as afterload. Now, if force of contraction is decreased, some quantity of blood will be remaining in the ventricles that increases preload. Afterload is increased when arteries are constricting. It is much harder for the ventricles to push the blood. The first category of drugs in the treatment of congestive heart failure is inotropic drugs. Inotropic means force of contraction. These drugs increases force of contraction of heart. In this, the first subcategory is cardiac glycoside, example digoxin. Digoxin is obtained from a plant Digitalis lanata, and it is only the glycoside which is currently in use. Well, now we will try to understand the mechanism of action of cardiac glycosides, that is digitalis. Let us consider this is one of the cardiac cell. Here is a plasma membrane. This is intracellular region, that is inside the cell, and this is extracellular region outside the cell. The plasma membrane is embedded with sodium potassium ATPase, sodium calcium exchanger, and L-type calcium channel. In sodium potassium ATPase, potassium ion is entering into the cell and sodium ion leaving the cell. In case of sodium calcium exchanger, there is an influx of sodium and efflux of calcium. From L-type calcium ion channel, calcium is also entering into the cardiac cell. Sarcoplasmic reticulum is the storehouse of calcium. As you know very well, in congestive heart failure, force of heart contraction is reduced. Even you know, calcium ion plays a very important role that increases force of contraction of heart. Digitalis is used to treat congestive heart failure. The mechanism of action of digitalis is very simple. It increases force of contraction of heart by increasing the concentration of intracellular calcium. That's it. Let us see how this is happening. Digitalis is a sodium potassium ATPase blocker. It binds to sodium potassium ATPase and block it. So the exchange of sodium and potassium is blocked, hence sodium remains inside the cell and potassium outside the cell. So more and more sodium accumulates within the cell. This increased intracellular sodium in turn reverses sodium calcium exchanger. Now sodium is leaving the cell and calcium entering into the cell. There is accumulation of calcium inside the cell. During the contraction of heart, L-type calcium channel will also opens and calcium enters into the cell. This increased concentration of calcium also triggers the release of calcium from sarcoplasmic reticulum through ryanodine calcium channel 2. Overall, cytosolic calcium increases that activates a protein troponin C on contractile muscle fibers, that is myofibrils, resulted in increased force of contraction of heart. In later phases after muscular contraction, sarcoplasmic reticulum calcium ATPase is getting activated and transports calcium ion from cytosol back to the sarcoplasmic reticulum.